Hello friends, hope you are safe staying indoors. Today we'll start with the topic obesity. Myself Dr. Vivek Waghachavare from the Department of Community Medicine. So in the current scenario, obesity is a very important problem due to why this is important, because lack of physical activity, continuously staying indoors, resulting in the consumption of extra calories that will lead to obesity or increase in the weight of more for many of the people. So what is obesity? It's to define it very simply, unhealthy diet often and lack of physical activity both culminate into obesity. And there are many misconceptions, specifically in India, that is while saying eating something extra. Suppose you are eating a bhajia that is extra, what will think, or what your elders will say, hey, उसमें क्या होता है, just eat this and run for few or walk for few kilometers and it will over. And what you will do, you will eat but never go on that walk. So all this tends to increase in the obesity. WHO estimates that over 1 billion adults in the world are obese or overweight, and about 3 are obese. So what is overweight and what is obese? Overweight is BMI from 25 to 29.9 and obese is 30 and above BMI. So 1 billion are nearly overweight. There is an exponential rise in obesity, specifically Southeast Asian countries and more specifically in India. In India, prevalence is nearly 12%, more than 12% of the adult female and nearly 10% of adult male are obese. What causes obesity? Simple terms, in taking excess food or taking excess calories. It's not that simple. It is a culmination of factors, but most, if you want to go basic cause, eating more causes obesity. So given it is said that consumption of 100 kilocalories per day extra will increase your weight by 4 kgs in a year. And what are those 100 kilocalories? What do you think consists of 100 kilocalories? Even if you take a tea with 2 teaspoons of sugar and with some milk, it can easily go to the 100 kilocalories. So the special chai, what it so extra chai or extra coffee can also increase your weight. Again, I am saying that this is not plain arithmetic, though it does not work like that. So many of you will think that okay, drinking 1 cup of less tea will reduce our weight by 4 kg in a year. It doesn't happen like this. There are many factors, but this is as simple mathematics as you can gain. What is passive overeating? Passive overeating is eating without biological need. What happens? There is a calendar which we functions, eating calendar. Generally, we tend to get hungry at the certain amount of time of a day, even if you have done any physical activity or not. Say, for example, when if you have a habit of eating food after coming from college, say at 5 o'clock. So during that period, you have done some work, you have walked for there, you have concentrated, some calories you have burned. Now what you are doing in your house, you are in lockdown, continuously or on your headphones, watching your Netflix or any streaming service for that matter. And at 5 o'clock, even if you had a good hearty lunch which you won't have in the college, then you start demanding for more food. So that is passive overeating. Binge overeating or binge eating, this is the most common cause of obesity in the Indian people. No doubt about it. Suddenly eating extra spurt of food, eating calories, huge amount of calories in one sitting. Maybe for somebody is giving party, some wedding functions is there. I have seen wedding functions with more than 20-30 courses of meal, and as you are given a 500 rupees or 1000 rupees some gift to that couple, so you want to justify that expenditure. So whole family will go on binge on eating on that thali. They will eat what they never routinely think of eating also. So in sudden a day, if one meal you are consuming 1500 calories, what will happen? All these will get accumulated, resulting in person becoming obese or overweight. Decrease energy expenditure. We are not living in the energy intensive environment nowadays. We don't have to work heavy for our earning. So you are not working in the farms. Even farmers have many machineries available. Even the construction workers have many machineries available. So I don't say those people are not spending their calories, but whatever their ancestors or few years before they were doing, now the expenditure has been reduced. So slowly overall the graph of expenditure has gone down very rapidly or exponentially, and this is a very big contributing factor to the obesity. Then metabolic factors. People like to believe that they have some metabolic problem. These are present in some people that can result to obesity, like Cushing syndrome, hypothyroidism, and Prader-Willi syndrome. But these are very rare. So if a person is obese, most likely it's due to its lack of physical activity and excessive dietary intake, not due to these factors. But still, as a doctor, you have to go through these things also. You have to consider these factors also. Now, obesity turns to be a familial thing. There are some genetic study undergoing, but still it has not been 100% proven. Generally, I think that familial thing is because of the lifestyle. It runs in the family and type of diet they choose. So it's more of that, and it's more of excuse than anything else. Age. Generally, after 40, people tend to gain weight. This continues up to, I think, 60 to 70 years. After that, it's very rare to see persons gaining weight. Generally, there is a weight loss. But from 40 to 70 or 60, it's the weight gaining process. For females, it's more due to continuously hormonal changes, due to pregnancies. Some ethnicities are more, again, more prone to develop obesity. It is seen that Caucasians, or what we call white people, they are less prone, and as compared to them blacks or Southeast Asian like Indians, we are more prone to the obesity. Educational level, it was previously believed that more the education, more the obesity is there, because they will do the 9 to 5 jobs, they will continuously sit on front of they will be sedentary and they tend to be obese, and that was true. And lower educated, lower socioeconomic status person, that work hard, and this was true to a certain extent. But now the picture is flipped. In Western countries, it is already flipped. The people who are earning more, they have more time to do exercise, they have more money to take a good healthy diet, and they are aware of the health problems. They will hit to the gym, and generally, remember this: healthy food is now more expensive. Take for example brown rice, or take for example fruits, take for example any salads. These are more expensive, and what is the cheaper way around? Your fast food, junk food, it is very cheap. Vada pav is there, it costs 20 rupees, so it's more cheaper than a healthy option. So nowadays it has been flipped. So even in low socioeconomic status, the people who are not having the white collar job, they also have a help of machineries and all other stuffs, and still they are eating these easy calories or high fat calories more. So what happens? Obesity is increasing in the low socioeconomic status also, or low education people also. So India, it is in the pincer move. In India, high socioeconomic status people are also having the obesity as a major issue, and even the low socioeconomic status. Then marital status, the married people tend to become more obese. That is due to pregnancy, then sedentary lifestyle, and all these things. More the number of pregnancies, women generally tend to get more obese. And this is not due to the fact that requirement of pregnancy. This is more due to the way our society works, or society functions, or beliefs, social beliefs specifically. So even instead of taking a nutritious diet, it will be a very high calorie dense diet for the female, because it is considered that she is eating for two and everything. And what we say, 550 kilocalories extra required in last trimester, and similar amount in during the breastfeeding nursing. But what we see in our cultural events, that cultural or beliefs, if we calculate the calorie intake, it is more than 7 or 800 calories intake increase per day due to pregnancy. And what happens, it's very difficult to cut down on the calories after the breastfeeding period is over, because what, the need or satiety has gone up. So the female tend to consume heavy food or excess food even after the pregnancy or breastfeeding period is over. So that all leads to weight gain. It is believed that some research indicates that the low birth weight babies, or those who are undernourished during early infancy, these child tend to accumulate more weight in their adolescence and adulthood. This has yet to be proven 100%, but this may be. What are the most critical periods of the weight gain? I think personally the most important critical period is adolescence. It is the age group when the person gains weight. It's very difficult to come back to the normal, and the people may have some issues or suffer from some NCDs for lifetime. How obesity is quantified? First and most basic thing is body mass index. What is body mass index? It's a weight in kgs upon height in meters square. So normal body mass index is 18.5 to 24.9. If it's above that, it's called as overweight, and it's above 30, then obese. More than 40 is called as morbid obese, and it's considered medical condition. But for Indian population or Southeast Asian population, it is believed that above 23 also, BMI 23 also, risk increases. So for our health, the values are little bit lower. 23 to 27.5 we are considering as overweight, and above 27.5 it's called as obese. Okay, if it's okay, if you can remember these things in exam, at least you should know the global standards. So these are the grades of obesity. These are the grades of obesity for the Asian or specifically Southeast Asian. What is waist circumference? Now waist to hip ratio is very important. In our NCD case discussion, we have repeatedly discussed this waist to hip ratio. There we have discussed how to calculate what is waist, what is hip. So waist to hip ratio, it should be less than 0.9 for men and less than 0.8 for female. Okay. Now type of obesity, it's either gynoid or pear shaped, that is evenly distributed obesity. In this person you see their hands and feet are also have higher circumference, and generally it does not look like they are out of shape, or if you can say so. So that is a pear shaped obesity. And what is android apple shaped obesity? This is very common in Southeast Asia or specifically Indian population. Here what it is, hand circumference or leg, everything appears normal, but only there is a central obesity, that is obesity around the waist region. People tend to get accumulate fat near around the abdomen area, and this is a single important risk factor for non-communicable disease and death. Now there are many hazards of obesity. Obese people tend to die early. That is the bottom line. That is proven fact now. What the symptoms they will exhibit? They will have difficulty in breathing, walking, joint pain, morning headache, shortness of breath. All these will accumulate to lead to hypertension, diabetes mellitus, and then it can lead to cardiovascular disease or strokes, and even colon and breast cancers. So these are the metabolic disorders that where obesity acts as a risk factor. We have discussed, you must have discussed in your introduction to NCD lecture, there are two types of risk factors, modifiable and non-modifiable. So this must come in the which category, that you know or you should find out. Okay, that is very important. These are the physical manifestations of obesity or physical problems caused due to obesity. These are the psychological. This is very important. Body image anxiety is one of the psychiatric disorder under DSM criteria. So what is body image anxiety? A person who is anxious or person who tends to have anxiety regarding to its body image or what is the projection of body image. And this is very common in the obese people. They always start to think that okay, what others are thinking, will they laugh at me. This happens in the adolescence period, and that's when persons start to get detaching. The person has very low self-esteem. The person will have low leadership skills. They will reduce the interaction with people. They will be friends with very few number of people. So it is kind of social isolation. Though current scenario social isolation is a good thing, but on long term it is not a good thing. So all these things lead to the psychological problems. Now, what is problem with obesity? First problem is acceptance. Second problem is acceptance of complications. Third problem is actually starting. And again, if person starts, continuation. And if all these things go smooth, there is always chance of relapse. So a person who is not doing regular exercise, that will understand this. If you are not doing regular exercise and if you are asked to start with even a small or simple exercise for 5 minutes a day, it's very difficult to motivate on same time of the day and start with it. Same comes with the obesity. But these are the benefits of losing even 10 kgs. So if a person is 110 kgs and reduces weight to 10 kg, then also these are the percentage gain or benefits gain in health. Okay. Now prevention. What are the levels of prevention? First is primary prevention. So what is primary prevention? Prevention of developing disease from the risk factors, or prevention of risk factors to resulting in development of the disease. So we are stopping the disease itself. So there is always aim to keep one's weight below 25 BMI or less than 0.9 waist to hip circumference. So this can be done by a proper diet since the beginning and continually monitoring the weight and good physical activity. As we always say, for primary prevention there is a mass strategy or high risk approach. What is mass strategy? It is meant for individuals in community. So health education is the best mass community. So in mass media or various other forms of health education, the people should be given information about what they should be eating. Even indirect mass strategies are there. So raising the tax on the junk food. So आपके McDonald's पे if GST is 18 and if it is done at 28, so it is an indirect strategy. So indirect strategy may not work, but people should be aware why they should not eat junk food, why they should eat, what are the better options, and what is exercise or how the exercise should be done. So all these things should come under mass strategy. High risk strategy means what? These are the people sorry, these are the targeted people who are have sedentary lifestyle, are pregnant, who are having family history of obesity. All these come under the high risk strategy, and there should be a targeted approach to finding these people and employing this strategy, giving them health education, monitoring them. This is the very important factor for primary prevention. What is secondary prevention? Prevention is early diagnosis and disease limitation. This comes under secondary prevention. What we can do, we can regularly monitoring one's weight or one's BMI, and if it is seen that BMI is raising, then this is the first warning sign that a person is developing obesity. So as simple as simple thing as standing on the weighing scale regularly can help one monitor its development of obesity. So how if one is understood that it is gaining weight, what is to be done? Lifestyle changes. First and most foremost lifestyle change is the diet therapy, or we can call slang is dieting. So modifying what the person needs is the best measure to prevent obesity. And second is increasing the physical activity. So that is this comes under behavior therapy. Drug therapy, genetic surgical intervention is there, but these things are not the best option. Now, what is diet therapy? Diet therapy is taking smart choices while consuming the food. So that is why in PSN when you are taking the case history, you take a diet history. In that you will understand what is the problems and what solution has to be applied. So what are the simple advices will give? First thing is that reduce the intake of simple sugars, instead replace them with complex sugars or complex cereals. One thing is that cereals is something that is very wrongly used terms. Whenever somebody says breakfast cereals, उसमें क्या होता है, आप लोग आपके अपने cornflakes or choco chips and all these things you consider as breakfast cereal. These are not at all healthy choices, though they are marketed as that because they contain a high amount of sugar, sucrose or malt sugar. All these things, there are very sweet names given to the actually the content is same, that is sugar. They are very high in that. Or even most of your packed juice, they come under added sugar nearly up to 11 grams per 100 gram, that is more than 10% is added sugar. So all these things are not healthy choices. Instead what? Whole cereals means kya hai? It's like a गेहूं का आटा or multigrain atta, or you can go for a brown rice, and instead of buying the juice, you can easily prepare homemade juice with all the fibers to not meshing it around. So this is one option. Then fat content should be limited. Fat are essential, but taking a good quality of fat is also essential. So instead of deep fried foods, okay, you can shift to other options. And fruits and vegetables should be an integral part of the diet. Now, whenever you are targeting reduce obesity, or when you are advising a patient, first thing is that calculate what is its requirement. For calculating that, ascertain what type of worker is sedentary, moderate or hard worker. We have discussed many times what is sedentary, what is moderate and what is hard worker. Generally hard worker is very rare to find, so don't go on just farmer hai to hard worker, because many times farmers actually have now employed many people, are using mechanized farming. So they get in detail what type of activity that person is doing. Then assess the BMI of patient and find out what is BMI and what is to be achieved. Then you can find out what is the target to be reduced. This is very important. Set the practical time frame for weight reduction. Reducing 20 kgs in 2 months, it's very dangerous. No, we don't want that. But instead, reducing at the rate of 1 to 1.5 kg per month. That is good, or even slow if possible. Then assess what is calorie intake, and then substitute those which are higher calorie with the better calories or better options, like fried foods. If a person is eating papads in his meal every day, you can ask that stop eating these pickles and papad. So this is the substitution. Instead of eat salads. Reducing weight, this is one example. Just go through it, you'll understand. So whenever case comes to you, you can when writing advice, don't go for generic advices that proper diet. What is proper diet? So like this, you have to give a diet plan to your patient. Remember this. Now what are the food substitutions? Again, whole grains, fruits, vegetables are very important. Potatoes and white rice should be replaced. Fried nuts should be replaced with the plain nuts. Then lean non-veg should be preferred, like egg and chicken. Oil should be reduced. Okay. These are some tips. These can be used by yourself or to your patients. So stress reduction, not eating food while watching TV or computer, these are very important. And drinking lots of water. Now this is a very important thing, fat diets. This warning should be given to a patient when your patient comes to you and you say you have to reduce weight in order to be staying healthy. First thing these people will do and go to some fat diets. These are published online. People are saying many things. Don't eat any carbohydrates at all, don't eat any fats at all, and many other things are there. So these fat diets are more harmful. They cause some severe deficiencies and some severe micronutrient deficiencies, and which can lead to severe acute conditions or even death. So there is no shortcut to success. This you have to grind in the minds of your patients. So you can't achieve anything on shortcut. It is a very slow and difficult process, I will say. So fat diets. So with this we end this lecture. Hope you understand something, and you can just message on the Google Classroom if you want to any clarification or anything. Be safe and be healthy.